Well, I'm a very active athlete, and I was working out about 6 times a week, and my hip just started to become stiff. There wasn't any one movement or anything that I did to hurt myself, and I tried asking the trainer what was wrong, and they just suggested icing, that maybe I had done something incorrectly in some kind of technique. And as weeks went by, it didn't really get any better, and pain started traveling to my lower back and down my quad, and my hip pain just kind of increased. At night I would wake up with like sharp pains. So I was referred to the doctor from my trainers. I got x-rays, led to an MRI where they found a small labral tear, and then I was referred to Dr. Domb from there.
A decade ago, we tended to think of hip injuries as injuries that happened to old people. Our grandmothers got hip replacements, and hip injuries were not something that we thought of as occurring in younger people or athletes. In the last few years, we've come to recognize that there is a whole spectrum of injuries that do occur in younger, active people, including athletes and also middle-aged people. Those spectrum of injuries can include labral tears and impingement, to name a few. Hip arthroscopy is an outpatient surgery. We use poke hole incisions, which are less than 1 centimeter each, and use a camera inside the joint to visualize the structures inside the joint. Structures like bony deformities or bone spurs can be corrected arthroscopically through these poke hole incisions. We can also repair structures such as cartilage or labral tears. This enables patients to go home the same day and have a quick recovery and return to their sports and activities.
Surgery was in the beginning of April, and so I kind of was in a crunch time with recovering and coming back for preseason in August. I knew I had to rehab consistently, and I did, and I went from not being able to run a straight line for 5 steps in a row to 100% range of motion back, full strength,